all the lies I've been taught in medical school, things in terms of, cholesterol and statin medications and, even antibiotics and pain medications and things like that. I mean, look, I was there in the hospital when the drug reps were coming in and telling us that synthetic opioids were not addictive.
What?
They were telling us that this is less addictive than, than heroin or whatever. And so
thank the Sackler family for that.
The OxyContin, dilemma and epidemic, was really started at, and my job as an intern in the hospital was to basically stamp out and write out all of the narcotic pain medications for all the patients that were operating on that day.
Wow.
And it was just a stack. And these patients would leave with a bag of narcotics, after whatever, like a hernia, appendicitis, or whatever.
Over the counter heroin, basically.
It was, and they were telling us that this, safe and not addictive. And here, use this little card for the pain scale. So it's a smiley face on this end and a frowny face on this end.
Yeah.
And so, how are you feeling today? And so if you're a frowny face, you get a script.
Wow. That's
re-up your medications. And so that's what was happening. And so I don't think I understood that. I mean, now looking back,
sure,
we know what kind of, devastation that's caused.
Absolute devastation.
Throughout.
Yeah.
So, but the A4M always, American Academy of Anti-Aging, always had kind of a unique approach.
Yeah.
They always brought in alternative medicine stuff, complementary medicine. There were, I would say, technical partners, in the expo talking about nutrition. What did I learn about nutrition in medical school? You could write it on the back of a matchbook with a crayon, honestly. I mean, it was like, here's how to calculate a diabetic diet. And that was the end of it.
Wow.
So I was learning all these things by osmosis, just being there, seeing it and talking to those people. And that really became the tribe that I was attracted to.
Well,
and then now that is the anti-aging, longevity, biohacking world. That's what it's really turned into.
Hey, good for you, man. I genuinely appreciate that from somebody who has been a patient for a medical professional to care about that type of stuff. It's so jarring sometimes when I go into a doctor's office and the person giving me like health advice, not to be crass or rude, is 120 pounds overweight. Hair is scraggly and they look greasy and gross. I'm just like, how are you? I know you got a degree and stuff, but like, I don't know if I completely take all your advice seriously, because like, there's a clear discrepancy between how you take care of your body and what you're telling me to do. It's hard for me to justify the gap. You know what I mean?
Absolutely.
So
I'll tell
I
you
appreciate it.
I was in my general surgery residency. Pretty sure it was either Beth Israel or Mount Sinai. And my chief resident was in between coronary vascular disease operations, coronary bypass treatments and procedures, smoking cigarettes in the stairwell.
That is insane.
I mean, he was a chain smoker. In between, you would do surgeries.
Yeah, right.
Once in a while, like we put down the cigarette, you go and do surgery.
Yeah,
I mean, literally, it was unbelievable.
Yeah, that is insane. Do you think
heart surgeon?
Yeah, that a heart
thoracic surgeon. Yeah, thoracic surgeon operating on lung cancer, heart patients.
Wow. Do you think that there's like a pendulum shift that's happening, like a swing the other way now?
Oh, 100%.
Yeah.
I mean, you could see, look at what we got. We have RFK Jr.
Right.
I mean, who had risen in prominence, after exposing everything that Fauci had done in his past. I mean, one of the most horrific books to read before bedtime ever in the history of the world is the Anthony Fauci.
Yeah.
But it tells the story, and it's well researched and well footnoted.
That's the crazy part. The crazy part to me is like, how are people not talking about that more, when it seems like if the information in that book were false information, that he would have been like, he'd be in lawsuit after lawsuit after lawsuit for like blatant, for libel, for blatant disinformation about some defaming somebody else's character. None of that's happened.
Correct.
That's mind-blowing to me, that this is the person that was in charge of public health for an entire nation during the pandemic, and nobody was asking questions about that. Nobody was like, hey, what about this though?
Well, remember during the pandemic, there were forces at play that were suppressing the people who were asking questions about that. So I have a lot of colleagues who were deplatformed, a lot of friends, in the medical profession
So dangerous.
who were taken off of YouTube. Their information on Meta, whether it be Instagram, Facebook, canceled, shadow banned on the algorithm. So they get like 2 likes instead of 2,000 or 20,000. And now we see them able to kind of talk about it more. And of course, Elon with X,
the acquisition of X was insane. So the Twitter files were mind blowing to me to see the just blatant censorship. Proven blatant censorship. And again, nobody talks about this. You have to listen to podcasts, and then all of a sudden you're like fringe and a conspiracy theorist when you're getting your information from a podcast instead of the news source.
You had to watch a video on Rumble? Yeah, because they don't delete it.
Right? Yeah, exactly.
But no, I mean, look, we have to be, intelligent, accessing intelligently this information, and assessing it. But the more information we have, the better choices that we can make. Exactly. We can filter through this.
Like Michio Kaku says, correct ideas come from interaction with incorrect ideas. And if you never allow those ideas to interact, how do you know which ones are correct? And if you start just censoring an entire swath of information, how do you know that the information that you have is the accurate information? There's no way to actually tell. There's no contrast between right and wrong if you're only allowing one source of information to exist. And it's pretty mind-blowingly blatant. But the reason I asked the pendulum shift thing is, so I had a recent battle with cancer probably 6 months ago or so. And after my cancer surgery, you might actually be able to guess this. Most people don't guess it. Can you guess what my prescription pain medication was for cancer surgery?
I mean, I'm assuming it's like probably just a super strong narcotic,
It was the complete opposite of that. Complete opposite. That's why I asked about the pendulum shift. They prescribed me 400 milligram ibuprofen.
Oh, okay. Well, that's good.
It's good, but also I was in a lot of pain. I was like, can you guys like 4 days? Like I don't need 4 weeks of this stuff, but like,
so that's where the
I'm in some pain.
Out of taking care of your
exactly.
pain. So you were,
but I'm in the core exactly. I was definitely a frowny face. Yeah, well, because like right after surgery, obviously, like they give you Dilaudid and they give you, the one everybody's scared of right now, fentanyl. They give fentanyl, all this other stuff, and then I leave with a prescription to go get basically just like over the counter ibuprofen. It's not even 800 milligram ibuprofen. Right. It's just ibuprofen.
Tough it out.
Yeah, exactly.
Exactly. That would be the ultimate part of the pendulum, right? Right. Here's a bullet and a shot of whiskey.
Right. Exactly. Which is essentially what my pain medication was afterwards. Cause I didn't even get the script filled. Cause I was like, what? I have that at the house. Like I have Tylenol, you know what I mean? Like what are we doing here, guys? But I understand I am in the core demographic of like the most likely to get addicted out of that, like young men. I understand we're, kind of in that demographic, but I was just like, can you meet me halfway here, guys? Like 3 days. That's all I'm asking for. Like that would have been extremely helpful. But I live in Vegas, so I just grabbed a couple edibles from the dispensary. Yeah, I was like, I need something for this pain, man. But overall, it's a good thing. I'm not, complaining about it. I understand that it had broader, terrible societal repercussions, but at the time, I was like, something besides ibuprofen, please. Okay, so.
And obviously you've recovered, you're healthy.
Yes. To put a pin in that story, yes, I'm in remission and all that stuff. Yeah. I might ask you a couple questions, just recommendations after this. But